Okay, all right, well, thanks for having me, guys. My name is Royan Kamyar. I'm running this company called Owaves, and we're in the mobile health space, specifically on the preventive side. So I'm going to break up this talk into 3 equal parts, okay? So the first part is really just going to talk about Apple and what it's doing in health, and why this is a really exciting time to be an iOS programmer. And I think the rock stars of medicine are actually, right here. I think the engineers are the new rock stars of medicine. And so I just want to tell you where I think the opportunities are and where you can make a contribution. So basically, the first part, we'll talk about what Apple's doing in health, how they're creating this ecosystem that we all can be a part of. The second part just kind of goes a little bit into my personal background, why I think I have a unique perspective, which leads into the third part, which is really identifying specifically where the opportunities are under the categories of lifestyle medicine and preventive medicine, and really defining what can be considered a new set of vital signs. And I think the prototypical example is happening with Fitbit and what they're doing with steps. Clinicians never really talked about steps in terms of research or prescriptions or discussions with their patients, but now we're using units of steps to prescribe what would be the best therapy for someone who just got diagnosed with knee osteoarthritis, how many steps they should be taking, whether it be a period of weeks or months. So these are new conversations that technology is enabling and creating. So we're armed with these devices, right? So we have the iPhone with its unique set of sensors, the ambient light, M8 motion processor, GPS, proximity sensor, barometer, microphone, camera, NFC, Bluetooth, Wi-Fi. What can we do with this? And now we have another piece of hardware with its own unique set of sensors, and apparently more being added on. Ambient light detector, accelerometer, gyroscope, compass, optical heart rate sensor that uses visible light, infrared LEDs, and photodiodes, microphone, NFC, Bluetooth, Wi-Fi leveraging off the phone, Apple S1 processor, and apparently rumors are that a camera will be added on to the next device. So these are the tools we have. And then what else is going on under the Apple umbrella? They've made a bunch of major hires in the space, and this has all been going on within the last really 2 years. So Michael O'Reilly is a physician. He used to be a professor at University of Michigan and UC Irvine. He was picked up from Masimo, which was really the category leader in pulse oximetry. So basically optical sensors. That just happened in July 2013. Jay Blahnik, he was basically the creative brains behind Nike Plus and Nike Fuel Band. He was also picked up in July 2013. Divya Nag, she led the StartX Med program at Stanford, so they gave birth to Lark and a couple other reasonably successful digital health companies. She has a background, graduated from Stanford, did some research in stem cells, and then got really adept at digital health. Ravi Narasimhan is a PhD electrical engineering from Stanford. He's behind their R&D. He was at Vital Connect, very savvy about respiration, activity monitoring. Todd Whitehurst, MD, PhD from UCSF, Stanford, Director of Hardware Development. He was picked up from Senseonics in July 2013. He was involved with glucose detection, non-invasive continuous glucose monitoring. Nancy Doherty, the list goes on, of these major hires. They're basically cherry-picking from some of the best biosensing companies in the space. So basically, and this all happening recently. So December 2013, she was at Proteus Digital Health, which many of you may know are doing the smart pill, and Sano Intelligence, basically wearable device, continuous biometric tracking. Wayne Block, director, PhD from Stanford, director optical engineering. He was picked up from C8 Metasensors, optical sensing expert. Gracie Agrawal, she's an expert in EEG detection, so we haven't seen any specific devices around neuromonitoring from Apple yet, but not only is she there, but Roy Raymond, another PhD from the Netherlands, he was picked up from Philips Research. He's a sleep specialist, so even though the Apple Watch isn't really doing much on sleep yet, we can assume that they're stacking the deck in that direction. Okay, so this is actually a really nice kind of sneak peek into Apple's fitness laboratory. So I'm going to see if I can play the video.
And ABC's Rebecca Jarvis got an exclusive first look inside the lab where they're putting it to some extreme tests. Good morning, Rebecca.
Hi, Lara. Good morning to you. And what you're about to see may look like the stuff of science fiction, but it's actually one of the most advanced fitness labs in the world. Kept under wraps for nearly 2 years, no cameras, no outsiders allowed in until now.
Behind this unassuming door, a covert operation at the world's most valuable company.
Let's go check it out. All right, give it to me straight. How top secret is this place we are sitting in right now?
You're the first person through that's not part of the Apple team, so it's pretty secret.
Here, Apple employees secretly working out in high-tech gear worth millions of dollars for nearly 2 years, rowing, running, downward dogging, and the kicker,
They didn't even know what they were working on. A few people would give it strange looks.
I would be wondering if I was watching Breaking Bad.
Exactly. It's a sci-fi episode of Breaking Bad. Exactly.
turns out it's all for this. The Apple Watch, unveiled in September and on sale next month. Its most anticipated feature, Apple calls it a health kit.
It allowed us to actually learn how do we measure calorie burn and where does exercise actually start.
Jay Blahnik, Apple's director of fitness for health technologies, gave us the top secret fitness tour.
How are you feeling? Thumbs up? And what is she wearing on her head?
That's to be able to trap exactly how hard is she breathing. It's the best way to really get to the truth of how many calories you're actually burning.
Here, we see climate chambers, where Apple is testing our body's response to different temperatures and levels of humidity.
Get a chance to see inside.
Here we go. Oh, this is chilly.
Yeah. So you can feel right now that doing an activity outside or coming in here, it really does replicate that kind of colder climate, and it's been really useful to us.
All this sweating in secret, helping Apple strive for new peaks.
Is this a game changer?
You know, I think we've amassed already what may be one of the world's largest pieces of data on fitness, and our view is we're just beginning. The impact on health could be profound.
So basically what Apple's doing is they created one of the largest known databases of activity tracking. Some of the statistics coming out of here is that they basically employed 26 full-time nurses, 14 exercise physiologists, have collected more than 33,000 hours of fitness data from Apple volunteers, testing them in one of 3 temperature-controlled exercise rooms outside on bikes, on the floor of the main fitness facility, and then joining yoga studio. The claim is that the company owns more metabolic charts, tools capable of determining exactly how hard an athlete is exercising, and has possibly collected more exercise data than any other university, sports lab, or research institution in the world. Okay, so this is the sophistication that Apple's going for. And these are some of the major partnerships that have been announced along with this major push towards health. Mayo Clinic, the original partnership was announced, I believe, sometime in June of last year. One of the more recent headlines, Apple's HealthKit collaborator Mayo Clinic launches its iOS 8 integrated health app. Epic, so Ochsner in Louisiana, is the 6th hospital system, was the first to link Epic to Apple's HealthKit. Okay, so basically getting EMR automatically populated into the HealthKit app. IBM, so they have this major initiative going around Watson Health and basically applying AI towards medicine. So an announcement came earlier this year that they're basically formally agreed to integrate Watson-based apps into HealthKit and ResearchKit tool systems for developers. There's also another side project going on where they're targeting Japanese seniors with providing them iPads with customized apps. And then meanwhile, all these names, so Johns Hopkins, Allscripts, Cleveland Clinic, Mount Sinai, Kaiser, have one way or another kind of agreed to use HealthKit as sort of a port to transport EMR, electronic medical record data to the patient. And these are all major institutions. I'm sure most of you are aware. And Epic, especially that partnership, I think turned a lot of heads because Epic had been playing really they're considered one of the dinosaurs in the space. They own a lot of medical data, patient data. I think the only system that has more electronic medical record data than Epic is Kaiser, and plus or minus the VA. So the fact that Epic was willing to play nice with Apple was a very big and positive sign because Epic hasn't been very friendly towards a lot of digital health startups in the past. And it's been very tough to work with them because they have such a conservative sort of mindset when it comes to experimenting with new technologies and new ways of handling their data, which is very much a competitive advantage for them to kind of keep under wraps. At least that was the way they had approached it in the past. So it looks like they're changing a little. And this is a little bit of news coverage on these multiple partnerships.
Apple is beefing up its Health Kit today to keep competitors at bay. That's a service it's developing that will allow health and fitness apps to work together. Reuters has learned the iPhone maker is talking to leading hospitals like Johns Hopkins and the Cleveland Clinic and electronic health records provider Allscripts to explore how they can work with Health Kit. The Cleveland Clinic says it's experimenting with it and providing feedback. Apple's already tied up with the likes of Nike, data provider Epic, and the Mayo Clinic. As of now, health data from medical devices and software apps aren't centrally stored. Apple wants to put all that in one place so consumers and healthcare providers can see that more easily. But getting all that together for mobile use won't be easy because Apple will have to confront consumer privacy concerns and satisfy at least half a dozen regulators. HealthKit is expected to be incorporated into the iPhone 6 that comes out in September. Apple's competitors include arch-rival Samsung, whose latest smartphones and smartwatches can monitor your heart rate and how far you've walked, among other things. One thing that doesn't look too healthy, Apple's and Samsung's sales in emerging markets. Fitch Ratings predicts cheaper handsets from Asian rivals such as Xiaomi, Lenovo, Huawei, and Micromax will steal market share from both of them next year, especially Samsung's.
Okay, so that was just a kind of a brief video that was talking about some of these specific partnerships and mentioning how the Mayo Clinic was basically green-lighted last year. Hopefully this video goes through. There's been a lot of discussion about how successful the Apple Watch has been doing, financially, economically, how many units have been sold, and whether or not it's hitting forecasts. And it seems like the data is a little clouded, but this is a good discussion.
Tech giant Apple reported earnings on Tuesday that beat expectations. However, concerns about iPhone and Apple Watch sales have some followers wondering what's next for the company. Joining us now to discuss the Apple Watch in particular is Ben Rubin, reporter at CNET. Ben, thanks for joining us today.
Yeah, thanks very much.
So as many expected, Tim Cook did not break out Apple Watch figures. Why didn't he do that? And does it really make a difference whether or not investors and rivals know the actual numbers?
Yeah, so you touched upon rivals. That's the main reason that Tim Cook provided as to why Apple very clearly decided they didn't want to provide a lot of specifics about the Apple Watch. They said that they didn't want to tip their hand to competitors. That matters a lot because we don't really know whether the Apple Watch met analyst expectations. Analysts were expecting the Apple Watch to sell about $1.8 billion worth, and we don't really know whether they hit that number or not.
And so I realize there's a lot of big question marks here, and the data is very, very limited. Based on your calculations, how do you think the watch did for the quarter?
My expectation is that they probably missed expectations, but again, I don't know that for a fact. At this point, the Apple Watch is bundled into this category called Other that includes Beats Electronics and iPods. And the other category went up by about $950 million from the year ago. So Tim Cook said that the Apple Watch did better than that $950 million. But again, that's nowhere near the $1.8 billion. So it's hard to say.
Yeah, certainly. What do you think investors can look forward to regarding watch sales?
I think that there's going to be at least a little bit more sales of the Apple Watch as people get to know it a little bit more, as it comes into more retail stores also. They're going to be coming into 3 more countries by the end of the month. That's something Tim Cook mentioned on the call yesterday. So look out for that sometime pretty soon.
And of course, we're talking about Apple Watch, but iPhone is still, it's still Apple's, really, it's heavy lifter. What is your take on that before we wrap up this segment?
So the iPhone was the big problem for Apple yesterday. They came in about 2 million units shy of what analysts were expecting them to sell, which they still ended up selling 47.5 million total iPhones, but that wasn't really enough for the very lofty expectations people put on the iPhone. So we'll see if they can come back and do a bit of an improvement in the next quarter.
It really is pretty incredible that 47 million iPhones could be short of expectations. It really speaks to how big Apple is around the world. Ben, thanks for joining us today. Thank you for watching. I'm Morgan Brennan. Have a great day.
So the best estimates I could get were somewhere between 2.5 to 3 million units sold in the second quarter. Okay, so hopefully that kind of sets the stage and kind of gives you sort of a global view of what Apple's doing in healthcare and why I think really that the time is now. All these things just happened within the last year or two. Now a little bit about me and why I think we'll give you hopefully some qualifications for what I'm going to talk about next, which are the specific opportunities. I had a European history teacher in high school always said, consider the source before you kind of listen or digest information that you get from a speaker or a book. Okay, so this is a little bit about me. That's me right here. Fortunately, the red doesn't represent disease, inherited disease in my family. These are actually all physicians. Okay, so I'm the a child of two physicians and a sibling of a physician. My brother-in-law is a physician as well. So I grew up in a medical family. But meanwhile, my dream was always towards entrepreneurship. So when I graduated from Cal in 2001, I double majored in biochemistry and business, and I went to Baylor College of Medicine, which had an MD MBA combined degree program. I didn't realize till I went there that because they were based in Houston, they were very focused on the oil and energy industry. So actually at the time, everyone in my class was just fresh out of Enron because they had just collapsed. And so I knew it wasn't the best fit, and I was the only person on the biomedical track in the business school. And I said, okay, I'm just going to finish medical school, do my intern year, which I did in New York, obtain my physician's license, and then actually come back home to San Diego to complete my MBA. And they just started the MBA program and really advertised it and set it up so that it sat at the intersection of healthcare, life sciences, and entrepreneurship. And so I wrote on my application, too good to be true. And they have a year-long lab to market course in which I started my first project, which basically involved looking for new technologies. So Scott is my teammate there. He was working as Ready Staff creative director at the time. And basically the idea was that we were being told by professors at UC San Diego to go to these different research institutions, whether it be Spaywars, Navy Lab, Salk across the street, Burnham Institute, or UCSD's Tech Transfer Office, find new technologies, and then those should be what we build business plans around and build teams around and run with. What we realized is that the technologies, the research going on in those labs is very opaque, it's very hard to see, and usually the only marketing that's done for them is a patent that they just simply copy and paste onto their website. So we decided basically to sell pickaxes to gold miners, create videos, short videos around different technologies, and sort of create a tech tube, YouTube for technologies, if you will. And so it was a fun project. We learned a lot. The thing was, we had 5 MBAs on our team, and once graduation came, people wanted to get salaries and take care of their children and things like that. So basically 5 MBAs went in 5 different directions, and the idea we like to say is comatose. It's not dead. We still think there's there's life behind it, but we moved on. And so kind of in the process afterwards, I was fortunate enough to meet through the business school a venture capitalist, local venture capitalist named Nasser Partovi. Some of you might recognize the name. He was former chair of ComNexus, and he had just gone through a terrible experience with his wife, who was diagnosed with breast cancer, and he really just couldn't educate himself online about her disease or by talking to experts, and he was just really frustrated that she was going through this very difficult process, significant time in their life, and he felt so uninformed, he felt so out of control or lacking control, and that was just not his MO. He wasn't used to just feeling so naive about something so important, someone he cared about. So basically he was really passionate about building patient education tools. It started off simply by using billing codes, diagnostic codes we got from continuing care documents to create personalized education for patients outside the hospital. We kind of grew that into an enhanced patient health record system that did remote monitoring and peer support. We ran clinical trials at UC San Diego, received FDA clearance. So one of the things that was my task as basically the only medical person on the team at the time was to create, and this project's still going, by the way, and it's fortunately it's generating revenue and being deployed at multiple hospitals. One of my jobs was to create the education modules for the different patients. And so here we were, basically one of our value propositions was that we create unique content depending on your diagnosis. But the funny part was whether you had heart failure, diabetes, obesity, chronic kidney disease, the end message was ultimately very similar. It was pretty much the same recommendations, which was you need to exercise, you need to sleep well, you need to manage stress, you need to spend time with loved ones, and you need to watch what you eat. okay? And it was just those, like, basically, you know, it was a little bit of copy pasting going on, right? Because it's the same message over and over to these different disease categories. And so, you know, I had obviously realized that to a certain degree throughout my training, but this just really brought it to light that, you know, there was something going on here. And this study, I think, really kind of hallmarked that in a different way, because this came out of a lot of the genetic initiatives going on in San Diego. And so Dr. Eric Topol, which some of you might recognize the name, was one of the lead authors on the study. And this was published in New England Journal of Medicine, 2011, so still around this time while I was at SDiOS. And it was titled Effective Direct-to-Consumer Genome-Wide Profiling to Assess Disease Risk. And the conclusion of the study, which was basically using, you know, user direct-to-consumer genetic testing to assess disease risk and encourage behavior change, was this. In a selected sample of subjects who completed follow-up after undergoing consumer genome-wide testing, such testing did not result in any measurable short-term changes in psychological health, diet, or exercise behavior, or use of screening tests. Potential effects of this type of genetic testing on the population at large are not known. So the message here is that no matter what type of profile these folks were getting, the end message was always psychological health, diet, or exercise behavior, right? So it's that same theme that, you know, even if your you know, specific genetic profile comes down to an elevated risk of heart disease, or someone else's comes up with an elevated risk of breast cancer, or someone else comes up with an elevated risk of diabetes, what's the message going to be from your provider to you at that point in time to either prevent or treat that disease? Exercise, eat better, sleep well. And so, you know, they were basically finding this out the hard way, that just outlining what your specific disease risk is doesn't necessarily nurture those behaviors. So the way that it kind of felt to me at the time was like, okay, there was a lot of action going on, whether it be genetics, stem cells, digital health, and I really needed to find my own space, you know, where I was going to make a contribution. And the fact that, you know, at the end of the day, really what it comes down to is us needing to take better care of ourselves, and that's where the bulk of the chronic disease that we're seeing today really comes down to, these same simple behaviors. I wanted to invest my time in that. And I actually was fortunate enough to hear a talk by Dean Ornish, who's clinical faculty at UC San Francisco, and actually alumni of the same medical school. So it was during my second year of medical school, and always this cartoon always stuck in my mind, where you have these physicians kind of mopping up the floor here, but really, you know, the faucet's been turned on, and that's what needs to be addressed, right? So why not approach the root of these diseases? Why not address the cause? And really, that hasn't been going on in medicine. And the reasons are, there's a lot of reasons behind that, but without digressing too much, one of the sort of the major overarching things, I think, to help frame what's going on in medicine is that, you know, we're evolving and disease is evolving, right? So before, things like starvation, trauma, infection used to, you know, affect morbidity and mortality for a major portion of the population. Fortunately, in developed nations, we have, you know, agriculture now, we have first aid, we have vaccination, sanitation, right? So we've conquered these disease sets, but we're facing new ones. And so the approach for the next generation, for our generation to health, has to be different. Specifically, we're kind of moving from an acute care setting to a chronic care setting, right? So this is a metaphor that I learned in my neurobiology class in college, where basically you take a frog and you stick it in boiling water, it'll jump out. But if you put that same frog in lukewarm water and you slowly boil it over time, it'll just sit there until it boils over and dies, right? And this is the type of disease that we're seeing in America today, right? It's lifestyle issues, it's sedentary lifestyle, it's processed foods, it's pollution. These are the things that we need to address. And Dr. David Katz, he's president of the American College of Lifestyle Medicine, head of prevention at Yale. He's basically synopsizing a lot of the research going on in the preventive medicine space when he says that 80% of all chronic disease and premature deaths are preventable, right? And going back to these same lifestyle behaviors. And so fortunately, this institution now exists, the American College of Lifestyle Medicine. It's pretty new. It just branched out of the American College of Preventive Medicine in 2004. And they're really advocating for these new set of vital signs, right? So the argument is that monitoring and managing these parameters is actually more meaningful for current populations than the traditional set of vital signs we used in the past, right? So if I knew my heart rate, blood pressure, respiratory rate right now versus someone else's versus another person's, I wouldn't be able as a clinician to make very meaningful prognoses or predictions about that person's health or well-being. Versus if I knew they were, if you take these new set of vital signs, I knew how much exercise they were averaging per day or per week, if I knew what their nutrition outlook looked on a daily basis, if I knew how much sleep they were getting, all of a sudden I can have a much better idea what that person's risk for things like obesity, diabetes, the killers of today are, right? So does that make sense? So basically, there's a shift now since we're going to chronic disease that the vital signs of the past are less relevant for the current population, which is usually outside the hospital, not in acute care settings. And so our outlook needs to change. Okay, are there any questions around that? Right.
Where's big pharma in this equation and the food industry?
Okay, so big pharma, I think, they are making moves now that they weren't making in the past. For example, with obesity, right? But they're taking the traditional approach, which is using pills or devices or expensive surgeries. And so the idea here is that with digital health, we can actually come on the preventive side and come up with new business models that are sustainable. And so, again, that's something that pharma is looking at. They haven't really jumped in or pioneered that yet because I think it's kind of out of their comfort zone. But they're eyeing those opportunities and they're starting these health IT research initiatives and even investment arms to kind of make sure that they cover that when the time's right. But that's the opportunity. It's not really using these, even though there's business being made on coming up with pills and surgeries and devices to basically do a fancier version of what you saw before, which is still mopping up the floor and not addressing the root cause of things like obesity, diabetes, heart disease. But there's a large growing number of physicians looking at the possibilities that can be done upstream, right? And so this is something that's coming from now from multiple major players in the healthcare space, right? So this is coming from physicians. I mentioned the American College of Lifestyle Medicine. This is coming from the government level, right? So we know that the healthcare economic crisis is actually a national economic crisis. And so this is happening from obviously the healthcare reform initiatives, putting more emphasis in preventive health. It's coming from insurers. It's coming from corporate insurers. So Starbucks spends more on healthcare for its employees than it does on coffee beans or rent, for example, right? So we know that healthcare addressing chronic disease is a major issue for not, and especially when you consider census studies of where the data is going to look like in 2030 and 2050. And so people who are planning ahead are looking at prevention as the major cost-effective tool to addressing this. Does that make sense?
Yep. Makes sense from the business side, but from the population side, getting the general population to embrace preventative.
Right. So this is our job. And this is the exciting part, if you ask me. Because really, I think people want to be healthy, right? And so you have to access that part of them.
Until they understand that they can't have that piece of pizza. Then they're not so into it.
Well, you can present alternatives, and how you present them and the way you present it, that's kind of where these opportunities lie. And is it coming up with those clever ways to do that? For example, the Fitbit. I was going to say MyFitnessPal, but that's really, that's the worried well. I think that use that more than the category that you're mentioning. Right, so brushing teeth and cigarette smoking are two great examples of public health campaigns that are considered very successful, right, with time. Those are obviously very expensive education efforts, but if you look at specifically the current obesity efforts, the diabetes efforts, there's a large growing contingent of young, socioeconomically well-off people who are very cognizant of this, and actually, there's cachet now involved with being very fitness savvy, or belonging to a gym or going to yoga class, right? That didn't really exist before. So that shift is slowly happening. All right, so now I'm going to talk specifically about what efforts are being made to make these behaviors more adoptable and attractive for the user, because that's really where the creativity comes in, where the innovation has to happen. So I'm just going to go through each lifestyle vital sign we discuss and kind of one by one address the digital health opportunities that I think we could take advantage of. And this was really the red flag that kind of, I think, really motivated me to enter a space. And we used it in the tagline for the talk because it's really a big deal. In 2005, the New England Journal of Medicine published a study with authors from University of Illinois, Harvard, and UC San Francisco that said the youth of today may on average live less healthy and possibly even shorter lives than their parents because of the current obesity and diabetes epidemics that we're seeing, right? So it's never really happened, that's never happened in modern human history where the child generation is actually expected to have a shorter lifespan and poorer quality of life than the parent generation. So it's a major red flag. And so what's being done in the digital health space to encourage or basically help people monitor and manage their nutrition outside the clinic, right? And that's really the goal here. So MyFitnessPal, as you know, has been a very successful example, recently acquired by Under Armour. And I believe the numbers are close to 100 million, if not beyond that in terms of number of users. And it's basically a food library, right? So you have to go through, and that's why I hesitated when I said, it's kind of one of these attractive measures, because it's really more savvy folks, I think, that are using it on a regular basis, at least the more active users. But it is being used, right? So we know that Under Armour acquired it for like 150 million, I think.
Okay, so does that mean that less educated people in poor communities are less likely to have both access to the tools and access to the information, and therefore are relegated to that's horrible lives?
No, I think that's not what anyone wants or anticipates. But the reality is that these devices or tools or software systems start in places where they can happen, and then eventually the goal is to distribute that more largely, right? So MP3 players, I think, is a good example, right? So iPod started in very privileged population, but gradually became more accessible with time. Organic foods, I think, is another example of that. So even though if it starts in one place, the goal is to grow it. And so basically, this is just a food diary. There's a lot of room for improvement, right? You have to either take pictures of your food, or you have to log it in through their food library. MealSnap is a purely picture-driven app where there's been a couple attempts around trying to come up with ways to analyze information that's brought to the app via pictures. There's been crowdsourcing attempts, for example, by using Amazon Turk, and then there's been just really in-house attempts where they try to mine through these. But so far, there hasn't been any successful examples of this, but there's a lot of attempts still ongoing in terms of basically food logging by taking pictures and then finding a cost-effective and accurate way to actually gauge nutrition content. The reason why it's very difficult, you would need two angles to get depth of food. You can't tell, for example, what type of oils are being used. It's a very challenging route, but the idea is that if you can get 80% of the way there, then it's still meaningful. And I just want to mention that these guys do the barcode scanning too, right? So Jawbone does that as well, and that's a very popular way to do it. So where can this go? How can this be improved? So there's hardware attempts, and then there's additional software attempts. So Yumly is a popular app that's out there right now. And I put that up as a model. So they're doing customized recipes and then delivering groceries based off your choices. And they're really generalizing their value proposition towards basically all categories. So you can imagine if this proves to be a successful business model, just pick your disease category of choice, and there'd be ways to replicate that in a deeper way for whether it be diabetes. Pre-diabetes would be a nice, small, and very powerful population to target. Chronic kidney disease, there's basically heart disease, cardiac rehab, so people fresh, that are coming right out of a heart attack that need to be on very specific diets. There's a lot of ways that if this business model proves successful, it can be replicated for different disease categories. The Healbee is kind of a notorious piece of vaporware that was on Indiegogo. I put that up there because it represents what Apple's trying to do and what really everyone's trying to do, whether it be Dexcom, Google, anyone who's making hardware that's doing any kind of body monitoring, which is passive glucose tracking, right? That's like the holy grail for the space. Healbee claimed to do that. They had a wildly successful Indiegogo campaign, but there's been no shipments made and no real proof of their technology. Non-invasive glucose tracking is a major category yet to be really addressed. I think it's actual Nobel Prize territory in terms of how difficult it will be. Dexcom just announced a major partnership with Google to make really small versions of their devices that are currently out for the type 2 population, which would be a huge move for them if they're successful. Right now, Dexcom's just targeting type 1 population. BitBite, this was a successful Indiegogo campaign that basically used an earpiece to monitor when someone's eating and for how long, and the pace of that meal. So it is pretty funny, but at the same time, it represents real science that's coming out that shows when you eat might be just as important as what you eat. And so even though this might be a very uncomfortable way of pulling that off, you can imagine that in Apple's health ecosystem, if you can somehow use GPS, accelerometry, machine learning, maybe there's a headphone piece of it as well, whether it be Beats or something else. But if you can actually track when and how long someone's eating, that's actually a meaningful proxy for calorie count, which is obviously proven to be very elusive and hard to pull off. And so this was actually supported by the American College of Lifestyle Medicine as a meaningful tool. The Vessel cup basically claims to be able to interpret what kind of fluids you're drinking and give you caffeine levels or sugar levels or that type of data tracking from your beverages. It hasn't shipped either, right? So that's another one that's just kind of still has some question marks around it, but these are the ideas coming out that basically could make nutrition tracking more passive and easier to once again monitor, manage, measure. And just to show how strong the appetite is for passive glucose sensing, there was one study that came out of UC San Diego from their, they have a dedicated wearable devices lab now. And it only had around 6 subjects, and it was a tattoo-based sensor, and it got international press based off its results, right? So I think most of you all are aware that any kind of preclinical study with 6 subjects, you really don't take that data too seriously. And the fact that this made the Atlantic, this made the Times of India, and MedGadget shows how hungry the appetite is for this technology. So this was just from, I believe, end of last year. Beginning of this year was published.
Is that Dr. Coleman?
No, that's not his lab. It's, I believe, Wang. So, okay, exercise is another major lifestyle vital sign. And so, this is kind of, behind the scenes, one of the root sort of public health sort of, this is what's causing a lot of our sedentary lifestyle, right? It's driving to work, spending, 8 hours in front of the screen, maybe you get an hour off for lunch, driving home, spending the rest of your night in front of a screen, and going to sleep, right? So it's the definition of sedentary lifestyle. If you do this for 20, 30 years, you're pretty much guaranteed to get at least one major chronic disease. So, and this was me today, right, as I was putting slides together for this talk. And, basically, we're spending significant amounts of our time in front of a computer with poor posture and exposing our eyes to circumstances they haven't really been built for. And so we can expect to see chronic disease. And specifically here, once again, that screen life, we're actually averaging over 8 hours a day now staring at a screen. And so if we're sleeping 8 hours, that means over half our waking life is spent looking at a screen. And so those lifestyles are very sedentary. And we've seen, fortunately, good examples of companies that have been able to make some sort of positive impact. And just, strapping something on your wrist, This Moves app obviously requires no external hardware, and Garmin has been a major player in the wearable devices category for years. We're seeing good adoption, and there's been a lot of talk about how after 6 months, at least 1/3 of Fitbit users no longer use their device. After 6 months, at least 50%, if not more, of patients stop taking medications and the other devices they're prescribed on a regular basis. So Fitbit's actually outperforming a lot of medications if 1/3 is actually the number. So I think that statistic needs to be taken with a huge grain of salt. And so the opportunity, how this basically evolves, and so we all know Fitbit was the darling success story, at least recent. I don't know if collapse is the right word, but I think Fitbit was valued around $9 billion. I don't know what happened after this last couple of days, but still, I think we're somewhere around $8 billion, $7 billion. So we know it's a successful example. And how do we improve from there? So Misfit has been all about trying to get these devices to really be seamless and beautiful, and really capitalize on the fact that these are fashion accessories that are coming out now. And so they partner with Swarovski, right, to make these high-end activity trackers. This is Amigo. I believe they're based out of Texas, and their whole value proposition was trying to get more specific with the data tracking. So if you're doing reps in a gym, or if you're doing yoga or biking, you should be able to track that as well. And we know that's a huge research initiative, not just for their team, but for every major team in this space. Athos is doing smart clothing. And actually, so there was a recent interview with, I believe it was Jay Gladnick, Apple's the main health guy, and they were talking about opportunities for the Apple Watch, and specifically they're talking about targeting these exercises that aren't simply step-driven. And so they're basically mentioning having apps that talk to smart clothing or even smart dumbbells to capture these things we do at the gym that aren't captured by the simple wrist-based activity tracker. Other room for improvement, these are 2 apps, Sworkit and FitStar. So FitStar was actually recently acquired by Fitbit, and Sworkit has been kind of hitting a lot of the top charts. They're basically really personalizing the workouts, getting really customized with the workouts they're delivering, and getting big on life coaching as well, right? So you get high-end athletes kind of driving the workouts. And basically, there's a really nice quote in Moby Health News that came from James Park, Fitbit CEO, which is, we're getting all this data, but we need to find ways that users can actually, we can create personalized workouts for the users based on the data we're getting. And so that was a big driver of FitStar acquisition for them. And so apparently that's what they're seeing as the next major step for their firm. Sleep. Okay, so about 60, 70 million Americans complain of some sort of sleep disorder. If you talk to certain scientists, public health experts, we're actually going through an epidemic of circadian rhythm disorders because our sleep-wake cycle has been essentially shifted away from the rise and fall of the sun because we are exposed by technology on a essentially 24/7 pattern. We became social shift workers with the way that we basically live our lives. And we know that shift working or living with poor circadian rhythms is a serious health issue. The World Health Organization has actually labeled it a probable carcinogen in the same class as UV radiation. And there's a lot of studies coming out about its links to obesity. Night shift work produces a 50% increased risk for heart disease, 30% increased risk for diabetes. So we know that managing our sleep cycles is very important long-term preventive health vital sign. And what's going on now is we've seen, Zeo come and go, right? So the head-based approaches to tracking sleep. We've seen the wrist-based approaches with arguable accuracy. Basis with its optical sensors is considered to be one of the more accurate on the market in terms of wrist-based sleep monitors, which makes us think that basically they're integrating the heart rate data into their sleep analysis. So Apple should have an opportunity there. They also have the optical heart rate sensor. At least as far as I can tell, it's the battery life issue that's really prevented them from making it a current feature. And basically the expectation is that you charge it overnight because it needs a daily charge. But hopefully that's one way it can grow. And here's kind of the innovation that at least I see happening now. A local company, ResMed, bought BiancaMed, which I think was an EU-based company, but it's doing non-invasive sleep tracking based on respiratory rate. And then there's LifeX. There's a lot of companies doing this now, which are essentially smart light bulbs that are usually controlled by an app to help control the lighting so that you'll actually sense or know when it's almost time to go to sleep. And kind of tied in with that, there's Flux, which basically limits blue light that you would get from your phone or your devices, because we know that blue light inhibits melatonin release, which is supposed to help you go to sleep at nighttime. And so if you're continuing to look at your iPhone or iPad, it's actually blocking the melatonin directly. Unfortunately, the iPhone hasn't enabled it yet, so there's some jailbreaking methods apparently in order to get that happening. Sleep Cycle is a phone-based sleep monitor. Its accuracy's actually been said to be very low, but the reality is it works like a timer. So you're actually supposed to turn it on when you go to sleep and press it when you wake up, and then it tracks your sleep, right? So I don't know if that really counts, but that's what it's doing. And then Bedit is a product by Misfit, and basically it's a mattress sensor that you put on your bed, and obviously can tell if you're on there or if you're not. And so it gets your sleep tracking that way. Okay, so stress management. So, stress is one of these fuzzy things that we don't always talk about, or is being talked about a lot more in terms of public health. And the reality is that heart disease is our #1 killer in the United States. Stress is a major contributing factor. And the most common mode of death for an American is actually a heart attack, 9:30 a.m. on a Monday morning. Okay, so we know that stress is a big deal, and that we need better ways to control that. And so that's why there's so much research. There's so much research going on in things like meditation, yoga, deep breathing. And we're living in an era of digital distraction, right? So we're getting messages, countless number of emails, texts per day. And so it's getting harder to kind of stay grounded. Bless you. So there's a need to help us sort of manage ourselves, especially as it relates to stress. There's basic mood trackers out there right now. Will is actually a company that came out from the founders of Lululemon, and it's supposed to be like 1-minute meditations that you can do throughout the day. And so some of where I think the more exciting things for the future, there are companies trying to track your stress levels through devices, and that's been proven really difficult, but Spire was actually started by a PhD from Stanford's, I believe, design and engineering schools. And basically they're using a belt-based device that can track your respiratory rate and actually tell when you're kind of going through normal breathing patterns or more stressed breathing patterns or calm breathing patterns, and try to encourage you to adjust your behavior accordingly. Bliss Buzzer came out of UC San Diego, out of Qualcomm Institute. They were using heart rate interval to try to detect when your more stressful or blissful times were, and get you to encourage your behavior change that way. Headspace has proven to be pretty popular. It's, I think, more customizable and gamified meditation app. So and they have a really good sort of founder. I think he spent a lot of time in monasteries and so has a credible reputation behind him. Mind Body Connect is coming out of Mind Body Online, which recently IPO'd. And so we know that the mindfulness yoga space, once again, it's a growing sector. If you count yoga as a sport, it's actually the fastest growing sport at 20% compound annual growth rate. So once again, it's actually becoming cool and popular to do these things. And so Mind Body Online, they actually started as a business software management platform for yoga studios and Pilates studios and acupuncturists. And now the new initiative, Mind Body Connect, is actually helping users find these different vendors of services in their local area. Okay, so love is probably the hardest lifestyle medicine or lifestyle vital sign to talk about, but the reality is it's important, and there's a lot of research growing around this, specifically because of the aging population. We know that one of the major contributing factors to cognitive decline in this population, to depression and dementia, is social isolation. So maintaining long-term and nurturing long-term relationships is actually a major preventive health pillar for these folks. And then we know it's true on the in terms of all age demographics, especially as it relates to mental health. And so there's more research and attention being paid to nurturing social relationships. Once again, this research comes out of American College of Lifestyle Medicine, Dean Ornish at UC San Francisco, and actually Blue Zone studies from National Geographic, where they actually sent National Geographic explorers to study communities that had much higher than average lifespans. So certain communities in the world, such as Ikaria, Greece, Loma Linda, California, Okinawa, Japan, that just produce more centenarians than average, and significantly such, to the point where they sent out teams to study these different communities, see what the commonalities are. And strong social structure is one of the major findings in National Geographic Blue Zone studies, that these folks in Okinawa, Japan, for example, they have small, tight-knit groups formed at the age of, I believe, 4 or 5 years old, that they'll maintain and nurture these relationships all the way through their 80s, essentially till they die. And they basically are a group of about 5 women, in this case, that will just form these lifelong friendships that are made and kind of coached by the community at a very early age. So this is what's happening now, and this is why it's an issue, right? So face-to-face contact is important, and it's not happening as much as it used to. And so the solutions here are tough because some of them actually, use the same technology to try to get back to that face-to-face, right? So, Tinder is a perfect example where you end up maybe spending more time on your phone to hopefully get that right face-to-face contact at the end. Gather app is Bluetooth, basically tracking your friends or social contacts in, let's say a college-wide vicinity, or Bluetooth radius, essentially. Independa is a local company that's basically addressing head-on the issue of the aging population, specifically in nursing home or remote care settings, where they're basically at risk of just spending all their time on a couch watching TV, not really talking to their loved ones, which we know is a major part of their nourishment, and helps basically sustain their cognitive power. So Independa is focusing on that. Other opportunities. So we know that Apple Watch is trying to do some, potentially, I don't know how you feel about it, maybe creepy things, sending your heart rate, with like these kind of real-time images to your loved ones. I don't know how that's going to be interpreted, but once again, they actually use the word intimacy. They want to create intimacy with these devices. So is that a step in the right direction or not? I guess time will tell. Google Glass, at least maybe with that type of device, you can actually measure or monitor how much face-to-face time you're having with other people, and actually who those people are. So you know that, well, if I see the shaking head, but the reality is, if you have a grandparent or a parent who's really at risk of basically spending all their time alone, you kind of want to know that at least they're talking to the neighbor X number of minutes or hours per day, or to someone X number of minutes or hours per day. So there could be meaning behind that.
Are studies showing that face-to-face contact is more meaningful to you than electronic contact?
Well, I would be interested. I don't think, how do I put it? There's a lot of studies showing that face-to-face, strong social networks, nurturing long-term relationships is healthy, helps prevent risk for all types of chronic diseases, whether it be heart disease, diabetes, metabolic syndrome, mental health issues, for example.
Interesting counterexample where I'm spending a lot of time at home because I'm out at work right now, and of course my wife is going to work, so I don't see her during the day, but I am able to maintain contact with groups, Blue Angel Group, Aviation Photography Group, and these are people who are similar to me, and we can share interests and stories, and at least it keeps me from just totally isolated.
Right. Well, so I think that's the interesting part, is that these technologies can also be part of the solution too, right? So even though they might be causing a major part of the problem in terms of our diminishing face-to-face contact, for example, actually one of the next examples that I bring up is this personalized health coach, which is kind of like Her, if you remember that movie. Is it Joaquin Phoenix? That basically I see a lot of the kind of health tech companies going in this direction where they're trying to create real-time life coaches or health coaches, someone that can be your virtual buddy, for example. In this case, Vital Health has actually real people behind it, but I think there's something meaningful here that whether it's one person or a community, that if you can actually leverage technology to help fight the same problems it's causing, is real. So, FaceTime, I think, is a great example of that, where, the fact that we're living in more remote family settings is actually, being bridged through technology as well. So it's a difficult, I think, topic to explore, but I think the end message, or at least the end goals, would be to at least in some way measure or monitor the amount of love that we're experiencing. And I know that's really hard, fuzzy concept, but I'll explain why that's important. And then also to nurture or grow that amount of love that we're exposed to. So, basically a diagnostic tool and a treatment tool. And the reason why this is important to get some sort of metrics on is because as a primary care physician, right, if you know that at the end of the day, for all these major categories of chronic disease that we're seeing that are not only affecting millions, tens of millions, hundreds of millions of lives, but also damaging to a very unhealthy extent our national budgets, right? They're basically not sustainable to take care of. So if you know that all these major categories of chronic disease are reduced to the same 5 behaviors, right? And you're a primary care physician looking at your patient who you're trying to prevent or treat, once again, heart disease, high blood pressure, diabetes, obesity, depression, post-traumatic stress disorder, ADHD. First line of treatment, best mode of prevention is lifestyle, osteoporosis, the list goes on. You want to send that patient out of your clinic and not have, when they come back 6 months later, a total black box with no information to know how they did on each of these 5 categories. Because that's how it is now. You really have no idea. You say, okay, I want you to exercise, I want you to sleep better, I want you to eat better, I want you to manage your stress, I want you to spend time with loved ones. You send the patient out of the clinic, they come back 6 months later, you have nothing to work from. So the idea is to actually create something for those interactions. When you do that follow-up visit, you say, look, I went from A to B, I went from A to G. You see the progress. You monitor and measure, monitor and manage those behaviors.
Physicians probably can assume that they're not going to do it. Now the question is, having the device might make you do it. So I think that's probably more of the, the benefit of those devices. Because who does what the doctor tells us more than 2 months? No one.
Well, I think these are really going to be cultural changes that we have to see. And once again, the fact that being fit is cool now, and this shows up on Instagram or these different social media platforms that are popping up where people are showing how much they're lifting in the gym or showing the size of these are actually, as much as those might be extreme examples, those are positive signs that there's a cultural change where and especially in these socioeconomic classes where they're being educated on how food is impacting their health or how lifestyle is impacting their health. There's actually cognition and change going on in the culture, and again, I think the prime example of that is what we see in just the yoga space, for example, and what that represents, or Whole Foods as a phenomenon, for example.
Doesn't it go back then to what you said about the Fitbit, that after 6 months, how many percentage aren't doing it, which is, what you said, 30%, if I'm not mistaken, aren't using it anymore. And you said that was even better than the results for people on medication. So when the doctor says, go away, and I need your information about your love interactions, 6 months when you come back.
Well, I mean, think about it. Would you rather take a medication that was just approved by the FDA, less than a year ago, and we don't really still know what the side effects are, or would you rather, would you rather be told to sleep more as a form of your therapy? And
human beings, particularly in the United States, where we're kind of gluttons and we have so many choices and we live the easy life and everything is just out there, we don't.
I think the data shows that that's not necessarily true, and it's definitely not true for everyone. Right? So, and the reality is that the people that are using these devices represent a growing demographic. So that's why there's business opportunity there, and that's why we see all these major companies putting a lot of investment in this direction. Yeah. Sure.
Owaves.
Yeah.
I want to make sure we get to before you. can you describe the value proposition? It looks like it's a behavior modification tool, pretty much, but I'm trying to understand how you differentiate it from the work of Ornish or somebody else in the prevention.
Right. So actually, we're trying to build off what Ornish has created, and essentially, if you take into account that there's these 5 basic behaviors we need to do on a regular basis in order to live long, healthy lives, there's only 24 hours to do them, right? And so we end up needing to plan that into our day. Otherwise, it simply won't happen, right? So, and what, the number one reason people will give you for not being able to sleep 8 hours or to get their workout in or to meditate would be to say that they don't have time. So if you know that you're limited to this finite 24 hours and that this is a change that you want to make in your lifetime, you can start coming up with an equation that makes sense for you, right? So basically what we're doing is we're integrating your calendar and your Fitbit, for example, right? So we're merging those platforms where you can actually manage your health on the same platform that you're managing your day. So it's combining the calendar with health tracking, essentially.
So it's to create a change in behavior, pretty much. I mean, in other words, I look at that heart thing and go, well, maybe you should move it earlier in the day, kind of thing.
Right. Yeah. I mean, that's the idea is supposed to be kind of fun that you can play around with it. So especially on the iPad, you have more room to kind of play around with things and sort things out and sort of optimize your schedule. But the idea is that you have 24 hours and you have certain goals that you have in line, especially when you keep reducing it to these same 5 lifestyle factors. At a certain point, you need to actually go ahead and think about how that fits into your 24 hours, and then start coming up with rhythms that you can use on a regular basis, change on the weekends if necessary.
Yeah, change that. But including my download, how many people have downloaded this since you've developed it and launched it?
We have 30,000 downloads. And our retention rates are actually pretty good.
But you don't charge anything.
Right, so we have business models lined up. So yeah. No, I'm happy to discuss. Yeah. Right. No, I mean, so a lot of these major companies start off free, but then they built more sophisticated pro versions that they charge a subscription for, and so that's likely the direction we'll head. Yeah.
I think we skipped ahead to someone who knows what your product is. Can you tell us what?
Sure. Yeah, so basically Owaves we call it the world's first wellness planner, and essentially what we're getting at is if you know that there's these 5 basic behaviors you need to do on a regular basis outside of work and traditional errands and things that end up on your day planner or calendar, then at a certain point you need to plan that into your day. And the really exciting thing that I think is not being taken advantage of right now is that the common denominator for each one of these 5 lifestyle vital signs is time. So if you can actually track, monitor, manage, measure these 5 lifestyle vital signs in terms of hours and minutes, it's actually a very simplified and unique approach to prevention. And it's holistic, so it's not just focused on 1 or 2 pieces of the puzzle, but it's actually looking at the whole platform. And so the idea is that you would actually sync this to your watch. So the long-term goal is that every time you look down at your smartwatch or your Apple Watch, you'll actually get cued into what the best activity, the healthiest, most productive activity for you at that moment in time would be. And so it's supposed to recenter you instead of distract you, which a lot of our technology is currently doing. It's supposed to help you kind of come back to your internal goals and basically help you plan out your day and prioritize what's most important to you.
Have you, among your customers, worked at any companies, HR departments and whatnot?
So we've talked to a few, and right now we're kind of happy with the traction we're getting direct to consumer, and we're being advised by certain advisors and investors that we should grow this out until we need to make that transition. So Scott on our team is back there. He's the creative director, and Jeff was actually led our iOS development for quite some time, and now he's playing an advising consulting role. But we are recruiting. We would like more iOS developers actively involved. So please talk to any one of us and let us know if you're interested. And once again, I think if you search for it, there's no calendars or day planners that are geared around health, and that's really a unique value proposition we're bringing to the table. And so we're one of the first to do that, to focus day planning around health, because we know how growingly important this is, if that makes sense. So I think it's a cool space to be, especially with the tracking capabilities that can be layered on top of that. Especially as the Apple Watch comes out and what we can do with the display and the tracking in tandem. Okay, yes. Thank you. Thank you.